So the vast majority of miscarriages are secondary to the egg and the machinery that surrounds the egg being inefficient. And so when the eggs are made, when they combine with sperm, especially abnormal sperm, then the probability of that conceptus or that baby being genetically abnormal is higher. And so that process gets much more common with age. So the vast majority of the evaluations for miscarriages, we don't really find a reason, and we attribute it to that physiologic underlying problem. But we do have to make sure that there really isn't anything underlying that causes you to have multiple miscarriages or puts you at a higher risk for having multiple miscarriages. So the one thing we do test is the anatomy of the uterus. And typically we can do a 3D ultrasound in the office, or some people even get an MRI of their uterus to make sure that the anatomy is normal. Then we want to make sure that you don't have what we call acquired thrombophilia, or you don't have antibodies to specific proteins on your cells that cause your blood to clot abnormally. We call that antiphospholipid antibody syndrome. That's a common thing that we find in couples who have recurrent miscarriages. The other thing we want to make sure is your thyroid function is normal. You don't have undiagnosed diabetes, which are all potentially contributing to an increased risk of miscarriage. Typically, people will test your ovarian reserve to make sure that the quality and the quantity of the eggs is not responsible for a higher probability of having a miscarriage. And then you want to get a karyotype on you and your spouse to make sure that when you make eggs or when you make sperm, there isn't a higher probability of having genetically abnormal eggs and sperm. And so you can be perfectly normal, but you may have like a deletion in the genetic material on your chromosomes, or a translocation, or some genetic material is exchanged between two chromosomes. And when you make eggs, that issue is magnified, and then more eggs are genetically abnormal compared to normal. And so those are the base tests that most people recommend, and that's what I would recommend. Remember, the vast majority of these evaluations are going to be normal, and so people will continue to treat you empirically for that. Most common medicine that people prescribe to treat couples with multiple miscarriages is baby aspirin and progesterone. And then ultimately, if that doesn't work, a lot of couples go to do IVF with genetic testing that identify the genetically normal embryos, and then transfer the genetically normal embryos to decrease the genetic risk for miscarriage, because that is, again, the most common reason.